Hi, everybody. Thank you for coming tonight. I'd like to welcome all of you in the room today. Thank you for a great turnout. We also have a bunch of folks joining us on webcast, so if you see me talking this way or this way, you'll know who I'm talking to. My name is Catherine Madden, and I'm the Executive Director of Kidney Cancer Canada. And I want to welcome you today, and again, thank you for coming, and tell you a little bit about our plans for this evening, and a little bit about Kidney Cancer Canada for those of you who don't know. We're going to start with an overview of Kidney Cancer Canada. Then we're going to have a presentation from Robert Kubish, who is a patient who's going to share his journey. Then we're going to hear from Dr. Daryl Drachenberg and Dr. Joel Gingrich, and then have a period of question and answer. And then have a little bit of a conversation, a roundtable here with you folks about what we can be doing in the province of Manitoba to build capacity, provide more support for you folks, and get some more sort of activity happening for you in terms of support, and for Kidney Cancer Canada in terms of awareness. So Kidney Cancer Canada, who are we? We were founded in 2006 by two patients who met in a waiting room by chance, both in at the same time to see their doctor. They got talking about the fact that there was nothing available for them in terms of support or information that really touched on kidney cancer specifically enough. They found the Cancer Society had some information, Kidney Foundation had other information, but there wasn't really comprehensive information and support for them. So they started this organization. And we are now the first and only Canadian charitable patient-led support and advocacy organization focused exclusively on kidney cancer. We have a growing patient and caregiver community. So from those two people in 2006, we're now up to 2,200 people across Canada and around the globe, in fact. And our mission is quite simple. It's to improve the lives of those affected by kidney cancer across Canada by providing support, information, and education, raising awareness of kidney cancer as a significant health issue, raising funds for research, and advocating for patients so that you have access to treatment and information and clinical trials. Behind the scenes, we are a very lean and focused organization. We have an active board of directors who you can see in that picture, and they are patients, caregivers, and professionals. So they have lived this journey and they know what it's like to be living with kidney cancer. We have one full-time staff member, that would be me, and then I have great support of two part-time administrators, one in French language in Quebec and another in Ontario in English. We have over 80 volunteers, and our estimate is that they contributed 38,000 hours in 2012 to our organization. So that's why we're able to do what we do with such a small group, and we're virtual. We work through webcast, we have online and teleconference meetings as a national board come together once a year, but everything else is done virtually from home offices around the country. We consider ourselves and are considered to be highly respected and credible. We have a medical advisory board of 19 of the best specialists in kidney cancer across the country. We have established a kidney cancer nurses network, and there's some information at the back for you. I know we've got some nurses here with us tonight, and we're really thrilled to have you here. It's an opportunity for those nurses to come together and share information and collaborate with one another and expand your knowledge. Because again, kidney cancer is a rare disease, so you're not seeing kidney cancer patients necessarily every day, and sharing tips about managing side effects and all of those other issues that come along with being a nurse care provider. We are also very happy to be part of the Kidney Cancer Research Network of Canada, which was established in 2012. We, together with the Kidney Foundation, are both funders and collaborators with that group, and they're looking at things beyond bench research. They're talking about survivorship, quality of life, personalized medicine, and genetics. So it's a really interesting and intriguing bunch of researchers looking at kidney cancer. We have very simple shared objectives. We want access to all approved treatments for kidney cancer so that all of our patients have access to the treatments they need when they need it. We want it to be regardless of your insurance status or where you live, because we know that there's disparity across the country in terms of what's covered, what's available, in terms of what line of therapy. We want increased awareness of treatment options for both RCC for both patients and with physicians across Canada. We want consistent and high quality standards of care throughout Canada. We want to improve patient quality of life through support and dissemination of information. That's what tonight is all about, an opportunity for you to learn, but also to meet with other people and establish a community for yourselves where you feel connected and supported by others. And we want to be sure that there's increased funding for kidney cancer research. We provide patient education and support. That's what tonight is all about. So for patients, caregivers, and others, we have our website, which is available in English and French. Hopefully you've seen it. We have an interactive map and a discussion forum, which is an opportunity for you to connect. We have peer support, both online and by telephone, and that peer support also happens on our discussion forum. And we have our patient education meetings. Tonight is one of those, and we try and have 6 to 8 regional meetings across the year, and we're webcasting them all this year so that no matter where you are across the country, you're hearing from the best and the brightest, as we have here tonight. And then we have our National Patient Conference, which moves across the country every other year, typically in Toronto. Last year, or earlier this year actually, we were in Vancouver and had 160 people for a full day of information. And our hope is that this coming year in 2014 in Toronto, we'll actually be able to webcast and live stream the whole day for everybody. So our website, as I said, it's a great opportunity, and if you haven't had a chance to look there, please do, and encourage those around you. So your caregivers, your family members who are interested. There's information for everybody. Somebody said when they came here tonight, I'm not a patient, and we have something for everyone. We have something for patients, for caregivers, for family members. So a lot of resources there, and again, a lot of support through the discussion forum and the interactive map. So for more information, please visit our website and be sure to register with us online. We have it in both French and English language. So just to wrap up, we're on Twitter, we're on Facebook, we're trying to do all of the social media and be out there and create awareness. So if you're on any of those social media outlets, please feel free to follow us and please retweet, share. That's how we create awareness and exposure for this organization.